because yeah. Okay. Welcome to today's class, and today's the topic is most important topic for all of you because it's the nutrition and NCD. Because this topic is most important for your day-to-day lives and also for your medical career as a doctor, because nutrition is the vast subtopic, and out of this the most important things is the the biggest problem now is NCDs, that is non-communicable diseases. Okay, like diabetes, hypertension, your cardiovascular disease, cancers, and so many diseases now. So, before coming to the topic proper, I just want to show you some results of nutrition, effect of diet therapy, effect of nutrition therapy to our patients. Okay, some of patients I have tried to give that nutrition, some diet therapy, some lifestyle modification, and you just want to see this result. Okay, because after watching this result, you just have a clarity that is this possible? Yes, it is possible. You just see one of my patients named Tinat Bhuya, who is previously when he was contacted me, his HbA1c is 9.6, glycosylated hemoglobin, fasting sugar 229, even after taking 8 tablets. Okay, even after taking how many 8 tablets with along with this insulin 52 units. Okay, so triglyceride increase 8 tablets per day before coming to this diet plan, and after coming to this diet plan, you can see the devastating result after 3 months. HbA1c come to 5.1, fasting blood sugar come to normal, serum cholesterol normal, insulin nil, and your medicines also nil. So this is the typical results of what we are getting from this diet therapy. That's why I'm always try to understand or counsel my patients with this therapy. Diet is very very important. Again, another patient like Harish Chandra Sau, who before coming to me or before diet counseling, before intervention, 42 units per day of insulin, and fasting blood sugar to 30, blood pressure 148 for 90, and like he's he also taking 5 tablets per day along with that. But after the diagnosis, after the interventions, his blood sugar you can see insulin nil, fasting blood sugar also come to normal, and I am in my line of treatment now. I will check his HbA1c after 3 months. Okay, then so many patients like Ma'am Sandhyarani Panigai, who is advocate, and HbA1c her 9.9%, after 3 months 6.3%, and obviously as you all know, if the HbA1c value is more than 6.5, it is called diabetes. Okay, but before that we don't call it diabetes, but pre-diabetes 5.7 to 6.5 pre-diabetic. Okay, so we must have to explain these lifestyle changes along with among all the lifestyle changes, diet plan is most important, nutrition is most important. You must have to understand this thing, how it is done, how it is happened. Okay, so coming to the proper definitions of this NCD, non-communicable disease. What is the meaning of non-communicable disease? Always remember, non-communicable means no communication. That means disease that are not spread through the contact. Okay, as you all know, communicable disease that are transmitted like viral infections, and scabies that are directly transmitted from persons to persons. But non-communicable disease that are not spread through the contacts, and it is mostly caused due to your long lifestyles, how people living, or the personal behaviors, or the work stress, or the environmental conditions. It depends on all this about lifestyle issues. Okay, then next is genetics. Also, some people are born with some genetic disorders. Environmental hazards. Suppose some persons are working in the some factories, and that is one of the cause of NCDs. Also, like COPD, asthmatic. You can see so many cases like NCD. If I give the proper uh, definition again, non-communicable disease that are cannot be spread from persons to persons. Okay, and mostly they are chronic. Chronic means that it is present either continuously or on and off over a long period of time. Okay, so common non-communicable disease are cancer. These are the questions for you during examinations, during your Viva also during MCQs also, which of the following are non-communicable disease except, or like tell name some non-communicable disease. Okay, so you can see this is cancer, heart disease, or cardiovascular disease, high blood pressure, stroke, heart attack. Okay, type 1, type 2 diabetes, arthritis, allergic. These are all non-communicable diseases. Okay, so then comes the types of non-communicable diseases. As you all know, mostly it is cardiovascular disease, coronary heart disease, as I told. Then cancer, chronic respiratory disease like COPD, diabetes type 1, type 2, chronic neurologic disorders like Alzheimer's, dementias, arthritis, musculoskeletal diseases, unintentional injuries from traffic crashes also that's come to under non-communicable diseases. Okay, so risk factor. If we come to the risk factor, then most important is your lifestyle, as I told previously, and environmental exposure or a hereditary characteristics of the persons with an increase in the occurrence of a particular disease, injuries, or other health conditions. Like suppose, as I told, some are modifiable risk factors, some are non-modifiable risk factors. Okay, so coming to the modifiable risk factors, it is most important because questions come like this: which of the following are a modifiable risk factor? Okay, or all of the followings are modifiable risk factor except. Okay, so you should remember the behavioral risk factor that can be reduced or controlled by interventions, thereby reducing the probability of the disease, is are called modifiable risk factor. So, like physical inactivity, it is under our control. Okay, you can, if we do physical activity, then chances of NCD is decrease, will be decreased, and like tobacco use, alcohol use, unhealthy diets. Okay, diets, nutrition comes under this modifiable risk factor. This is one of the most important risk factors because if we change our diet, like if we increase fat amount, more sodium, then chances of more blood pressure, more diabetes, like that, more obesity. But if we take more amount of fruits and vegetables intake with more amount of fibers, then the chances of this chronic non-communicable disease will decrease. Okay. Second, lifestyle choices and the disease that I told the factors that can we control are modifiable risk factors. Okay. Diet is most important. Stay physically active, maintain healthy weight, get enough sleep, manage the stress, and avoidance of alcohol and tobacco and other bad habits. Okay, so these are under our control. That's why it is called modifiable risk factor. We can modify this anytime and we get rid of this disease also, as you see in the results section. So the main important is among all this is diet. Okay, also from exercise, diet is most important. Yeah. Then non-modifiable risk factors, like a risk factor that cannot be reduced or controlled by interventions. For example, your age, we cannot modify that. Your gender, male or female, race, your family history, genetics, these are all non-modifiable risk factors. Okay, and you must keep to remember these things. Otherwise, this is a common question asked in your Viva, uh, in your long questions, maybe it may be common question also. Okay, so these are the lifestyle that we cannot are under control. So that's why hereditary, genetics, age, gender, and ethnic group, these are all comes under non-modifiable risk factor of non-communicable disease, NCDs. Okay. So as I told, the where these are the most important things, because if we lifestyle is bad lifestyle, bad diet, bad physical activity, more physical inactivity, that leads to more oxidative stress, more toxic product in your body, more obesity, and they are all vice versa, and that leads to chronic inflammation. Remember the word chronic inflammations. Okay, and this chronic inflammation leads to future of the chronic non-communicable disease like diabetes, blood pressure, cancer, cardiovascular diseases, stroke. Okay, these are all chronic inflammations going inside our body. So if we change this inflammation, if we take anti-inflammatory diets like plant-based diet, but to avoid the animal food, then we can reverse this to good as a normal person again. Okay, these are all reversible conditions also. So that's why I'm telling ki anytime you can take U-turn and become normal person again. So what is NR NCDs? NR means nutrition related non-communicable disease. Okay, chronic illness result from altered dietary pattern and changed lifestyle, termed as NRNCD, incorporates the effect of diet, physical activity, and body composition. Okay, all that means nutrition related activities that we are incorporating in the life of the persons to prevent the non-communicable disease are called NRNCDs. Okay, so if we come to some historical nutrition background, you remember these words: historical nutrition. That means human diet and activity patterns and nutritional status have undergone a sequence of major shifts. How initially what happened, the persons the humans have doing more physical activity, live in the villages, and they are eating some more amount of fiber diet. But now due to some shifts, okay, shifts means changes in the food habits, their persons are now taking more amount of refined food, more amount of factory made food, and forgetting this more amount of fiber food. They are suffering with so many diseases. Okay, since 18th century, the pace of diet and activity change appears to have accelerated. How? We see the three major changes have taken place. What are these changes? Three major changes have taken place. Okay, these are the demographic transitions, how epidemiological transition and nutritional transition. So, in coming to new demographic transitions, if we see the shift from pattern of high fertility, high mortality to one of low fertility and low mortality, typical of modern industrialized country, developed country, we see the fertility rate is low and mortality rate also low. And epidemiological transition, if we see the shift from a pattern of prevalent infectious disease associated with malnutrition, previously more communicable disease, to now more non-communicable disease, more urbanization, more industrialization lifestyles. Okay, these are the epidemiological transitions from of disease from more communicable disease to now more non-communicable diseases. And also nutritional transitions, as I told, increased consumptions of unhealthy food compounded with increased prevalence of overweight in middle to low income countries. This is the most important thing what we discussed today, because if we change our intake, then our output also changed. Okay, so mostly we change our nutrition and our balanced diet. What is balanced diet? You should know that has serious implications in terms of public health outcomes and risk factors. Okay, that's why most people now concerned on this particular topics of nutrition. So coming to the major nutrition related NCDs, these are obesity, diabetes mellitus, cardiovascular diseases, hypertension and strokes, osteoporosis, dental disease, some types of cancers also. Okay, mostly due to nutrition related deficiency or due to excess, these diseases are prevalent now. So here the common risk factors, as I told, four major type of NCD we see. Mainly, first is your cardiovascular disease, second is your diabetes, third is your cancer, and fourth is your chronic respiratory disease. Under this, everything comes. Okay, here the four major disease of four major disease and four modifiable major risk factors are. Okay, first is your tobacco use, second is your unhealthy diets, third is your physical inactivity, and fourth is your harmful use of alcohol. Okay, so these are the four major NCDs and four modifiable major risk factors. You have to remember at least remember these four diseases: cardiovascular disease, CBDs, diabetes, cancer, chronic respiratory like COPDs. Okay, major four. Yeah. Then come to one by one. If we go through that, first is abnormal or excess fat accumulations in adipose tissue that health may be impaired. That means this is the definition of obesity, where excessive accumulation of fat or adipose tissue, result of chronic positive balance. That means your intake is more, output is less. Okay, so how we classify that? BMI 18 to 24.9. This is not 5, this is 9. Okay, 24.9 is normal, 25 to 29.9 is grade 1 overweight, and BMI 30 to 39.9 is grade 2 obese, and more than 40 is called morbid obesity or grade 3 obesity. Okay, so you mostly remember this formula. What is body mass index? BMI. always comes at questions for you. BMI, body mass index, weight in kg divided by height in meter square. So I request every students to measure your BMI. If it is less than 24.9, then you are under the safe range. Okay. So measure your BMI and let me know what is your BMI. Weight in kg divided by height in meter square. I want this information in next class because I want to know whose BMI is more than 25. They should have to take immediate protection, or you can take protections of your parents also. You can measure the BMI of your parents, of your relatives. Okay. So come to this slide, the body mass index. This is normal is 18.5 to 24.9. Okay, as I told, then overweight means 25 to 29.9. Obese means 30 to 39.9. Okay, and morbid obesity means more than 40. Okay, so these are the red signal. Okay, red and yellow. You must have to take precautions to come to this zone, normal zone. Okay, yeah. So this should be your modification through the diet, exercise. Yeah, because to avoid these complications, we must have to do that things. So what are the complications of obesity? As you all know, obesity is the major risk factor for starting from all the disease from head to toe. Okay, stroke, sleep apnea. Yeah, as you've seen, so many patients now in hospitalized with this stroke, CVA, cerebrovascular accident. Okay, hypoventilation syndrome or sleep apnea, obstructive sleep apnea syndromes. So many people snoring, obese, as you know, they are suffering from this sleep apnea syndrome due to this obesity. Metabolic syndrome like diabetes, dyslipidemia, more cholesterol, more triglycerides, body fat abnormality, visceral fat is more than your other fats, osteoarthritis because of heavy weight. There is a pressure over the joints, and these joints gradually becomes the synovial membrane become damaged, and that leads to osteoarthritis. Okay, so it's also a risk factor for heart disease, high blood pressure, diabetes mellitus, and cancer. Okay. So mostly we see obesity is a major risk factor for all the chronic disease and NCDs. So we must have to maintain a healthy lifestyle with proper weight, proper height, to maintain the BMI in normal zone. Okay, BMI is a questions for you. Just take a screenshot of this slide, and you must have to remember what the grade 1, what is the grade 2, and grade 3 obesity. Okay, hope you have taken this screenshot of this slide, and then I'll ask in the end also what do we mean by obesity, what the morbid obesity. Morbid obesity sometimes ask in our Viva also, in NEET PG also. So remember that things more than 40 BMI. Okay. Then come to factors associated with the obesity epidemic, where this obesity is more epidemic now, because if we told after the COVID, the next epidemic is NCDs due to obesity. So how caloric density food, like use of just a minute, high calorie density foods using of cooking oil rich in fat. Now if you've seen some messages also spreading like more amount of saturated fat or palm oil those who are using, that is one of the major risk factor of this hydrogenated fat that leads to more triglyceride that damage our artery also. Increase portion size and access to plenty food. That means people are now not eating in moderation. Okay, they are eating like high portion size, large portion size. Okay, that means intake is more and output is less. So accumulation of the this fat inside our body that leads to disease. Then inexpensive foods, fast or junk foods more, sedentary lifestyles, lack of exercise, then commercial practices. That means people are so many commercials nowadays. Always type A personality people. You know, they are always worry about their business. They are always worry about everything should be happen within a minute. Okay. Then overweight as evidence of the social status also, because nowadays people think that overweight means the person is more rich, the person is more healthy. This is a common problems now in society also, because when some patients come to me first time, and they told that, sir, my weight was previously 70 kilo, now it's come to 60 kilo. I lost 10 kilo due to your diet. But it's some people told me that your weight is how why your weight is so much reduced, you are looking abnormal. But they don't know that that person is normal who follow my diet plan. But the persons who are telling these persons that they are abnormal, because their attitude is that every person's now in the society with large abdomen, like overweight, like 3 to 4 6 month pregnant, 9 month pregnant, looking like that. But really, they are the patients, not the persons who are following this diet plan are the patients. Okay, so they have a overweight is as a evidence of social status. They think that yes, if obese means our social status, economic status is good. Okay, westernized diet as a symbol of social status also, because westernized diet means more packaged food, more refined food. Okay, that more complex, so many persons taking, because complex is high glycemic index, we should not have to take that. Beliefs and attitudes about the body image also matters a lot, because as I told, if a obese person because of diabetes, suffering from diabetes, when he follow the diet pattern, obviously his weight will decrease, weight loss occur. And for that he or she will be criticized by his community, her community, that you are looking very thin, very slim after the diet plan. What's the problem with you? Or really not problem with that persons who are following the diet plan, but the persons who told that persons, "Hey, you are obese." Okay, hope you got my point, because now people's always thinking about the social status, and all this thing, body image. That's why you must have to just correlate this thing with obesity. Then come to cardiovascular disease, as you know, are growing contributor for global disease now. It is caused one third of the all deaths globally. Most common cause of death now, cardiovascular disease. Okay, so you must have to prevent that things by also deaths projected to increase to more than 24 million a year by 2030. It is global estimated by WHO. Okay. Then CBD, a high intake of dietary fat strongly influence the risk of CBD. Okay. That's where always we are trying to reduce the amount of oil in the diet. Okay. Then SFA, that is saturated fatty acid, dairy products and meat raise the cholesterol levels. That's why in my diet plans, mostly plant-based diet plan, we don't want to harm any animals. That's why we are giving this diet plan, and also we are getting the results. Whole food plant-based diet that doesn't contain any animal food. That doesn't. At the last, those who are present in the class, they can get my diet plans also. They can get my advices also. No need to worry at all, because I know maximum of our parents also suffering from this disease, like diabetes, blood pressure. They are taking bunch of medications which should not be taken. Okay, because if we change the lifestyle through this diet, then they can able to reduce the medicines to this gradually. They can able to reverse it disease also completely. I have seen even my patients, those who are taking 40-60 unit of insulin, now they are not taking any insulin with this diet changes. That's why I'm taking this topic is most important topic. You must have to know that for lifetime it is helpful to you, because as you see, just 2 days back, one of our young doctors, assistant professor from department of oncology, oncosurgery, had died due to this heart attack. Where even now maximum doctors are unaware about this nutrition. That's why they are always think that nutrition has no value. That's why they are suffering a lot. Even some medical students also have seen, they are very their diet pattern is very bad, even some mess also. So you must have to change your diet pattern and to prevent from these diseases. Pupa means polyunsaturated fatty acid, like sun soybean, sunflower oil, fatty fish and plant foods lower the risk of CBD. Okay, so remember this, which is important. You must have to reduce the saturated fat or stop that, like dairy products, milk and milk products, that all contain saturated fat, that increase your cholesterol level very much high. And as you all know, cholesterol level is more increased, raised cholesterol level is higher chances of diabetes, higher chances of your blood pressure and CBD. Okay, as you see, this is a cardiovascular disease, just a image of an artery. This is one of the artery. Okay, coronary artery, suppose. Okay, this is normal artery. Okay, some gradually this is the cholesterol particles in lipoproteins form, and cholesterol deposited in the lining of this particular. This is called endothelium, as you all know from pathology. Endothelium. Okay. Then this cholesterol gradually deposited and make a build up the begins and make a plaques. Okay, this is called atheromatous plaques. Okay, and this atheromatosis. What is the composition of plaques? You know from pathology. Okay, this is some calcium crystals, some fatty cholesterol. You know, so you must have to remember this. So some days will come, this atheroma or this plaques get burst out. Okay, when this plaques get burst out, if the artery is coronary artery, this is called heart attack. If the artery is your any brain artery, cerebral, it's called CVA. Okay, or it's called stroke, depending on the name of the artery. Basilar artery, suppose if it is affected, then your CVA. Okay, so like that, according to the supply of the artery region, the name of the disease will be different, but the same mechanism is same. Okay, the risk factor is your high cholesterol in your diet, that leads to plaque formation in your diet, and that plaques, that atheromas of plaque, that lead to build up, and one day will come that burst out. Remember my point. This is most important thing you must have to remember. So from today, you must have to also decrease this saturated fatty acid amount. Saturated fatty mostly present in your all milk and milk products, your meat and non-veg foods. Also remember some plant like palmitic acid and palm oil or all this. But must remember the plant-based diet doesn't contain any cholesterol. Remember that thing. Because cholesterol is always come from your animal food, direct cholesterol. But if we are plant-based diet, then cholesterol will come mostly from your milk and milk products. So if we stop that milk product also, the cholesterol level automatically we cut down from our diet, and so we are escaping from this particular disease risk factors. Okay, so these are the risk factors of CVD, as I told: obesity, high blood pressure, cholesterol level, yeah, more than 200, physical inactivity, hereditary history of CVD in the family is if present, then chances more. The gender mostly male, because type A personality. Okay, type A means always hurry, hurry, hurry. Yeah. Hurry makes curry bad. Yeah. Increasing the age over 65 years, cigarette or tobacco smoking, history of diabetes. These are all the risk factors. There is some factor which we can control it, and we can reduce the disease. Okay. Hypertension and stroke. So as you all know, the blood pressure, if more than 144 mg, this is called high blood pressure. And a common medical problem that is also called silent killer, because sometimes we cannot detect blood pressure also from persons, even if it is high amount, but after without any symptoms. Okay, so that's why it is called silent killer. One day, sudden the persons come with stroke or heart attack, and they will die immediately also. So it is advisable after 30 years of age, every person should at least 1 year should have check up their blood pressure, their blood cholesterol or lipid profile, and some other parameters which is most important for their lifestyle. Okay. Mostly people in the middle or older age groups, hypertension is a powerful and independent risk factor for CBD, and dietary potassium lowers the risk of this cardiovascular disease. How? Because dietary potassium mostly present in plant-based diet. Okay, if we are taking more fruits, more vegetables, at least 4 to 5 servings per day, as per recent WHO guidelines, 4 to 5 servings per day. If we take fruits and vegetables, that you can get sufficient potassium level, then this potassium will help to lower the risk of your stroke, lower the risk of your CVDs. Okay, regular or frequent intake of fruits and vegetables protective against the hypertension. Always I also advise this to my patients, because they are also getting so much of risk factor. That's why we first make initial checkups for the level of their blood pressure, what the level of their lipid profile, and other HbA1c, glycosylated hemoglobin, for if possible to know the diabetes or pre-diabetes. Okay. You should update on this knowledge also. And hypertension respecters means high salt containing diet. As you see, now persons are taking, even you are traveling, they are taking high salt containing packet food, biscuit, mixture, and all these things. That and packet food that are obviously containing high amount of sodium, and that's the main cause of your hypertension now. Calorie dense food they are taking, always calorie dense food means your milk and milk products with high calorie oils. Okay, less physical activity that leads to more increase in the obesity. Okay, and ignorance of or due to laziness, urbanization, sedentary lifestyle, and high level of stress. Remember this thing. Sedentary lifestyle is one during this lockdown, during this COVID period. More cases of this particular patients are coming. Where? Because you know, because due to this some persons cannot go outside the home, and due to that they're sitting in the home, work from the home, that leads to sedentary lifestyle, and also high level of stress, also high stress level that leads to so many disease, because from stress they lead to depression, they lead to increased blood pressure. So they are all risk factor for hypertension. Okay, HT means hypertension. Yeah. Then come to your diabetes, which is mostly is a major problems now in the society. Diabetes is a disorder of metabolism, as you all know. You know, which metabolism? Your food metabolism. The way the body uses the digested food for growth and energy. Okay. How? The glucose level is abnormally high in diabetes. Basically, we go, there are four types of diabetes. Basically, four types. How? Type 1 diabetes, in that is called insulin dependent. Type 2 diabetes, previously called it was insulin non-insulin dependent, but now the name is changed to type 2 diabetes. Gestational diabetes, mostly seen in pregnant women, and pre-diabetes, that means impaired glucose tolerance test. Okay. So type 2 diabetes is mostly caused by modifiable risk factors and is most common worldwide. That's why yeah. Type 2 diabetes is caused by modifiable risk factors, mostly due to diet. Okay. And this more than 90% of all the adult diabetes cases are type 2 diabetes. Remember this. So type 2 is the most common form of diabetes. Remember this. But also some other type diabetes like type 1, type 1.5 also there. Remember this. Okay, that's called MODI, MODY. And or genetic based some pancreas destroyed due to some genetic issues. Lada is also there, and also you read this all these types and different kinds in medicines. But today in nutrition topic, we know the topic more. What is the importance of nutrition in controlling the diabetes? Okay, you read different kinds of diabetes: type 1, 1.5, type 2, type 2.5, like that. Alzheimer's disease and all these things. So just remember major four kinds of diabetes: that is type 1, type 2, gestational, and pre-diabetes. Okay. Yeah, and most common is your type 2 diabetes, more than 90% cases. So, if we come to the burden of the disease, burden of this diabetes, 347 million people worldwide have diabetes. More than that, also in 2004, an estimated 3.4 million people died from the consequences of high blood sugar. More than 80% of diabetes deaths occur in low and middle income countries like India. And the WHO projects that diabetes deaths will increase by two-thirds. Okay, between 2008 to 2030. So now 2021. Between this, it is going on also. This true what WHO projected initially, and as you know, because of more than two-thirds, yes, obviously it's more than 60% now due to this non-communicable disease patients are dying. 60-70%, yes, this true. Okay, so healthy diet, regular physical activity, maintaining a normal body weight. So, what is your normal body weight? How can you know that? You just remember the formula of Broca's formula. Okay, what is Broca's formula? As I told to my patients, measure your height in centimeter minus 100. Do it minus 100 is your normal weight as per Broca's formula. It's a common formula, but BMI is more better than that also. So, as per Broca's formula, what is your normal weight? That means you should have to measure your height in centimeter minus 100 is equal to dash. That means I am giving you one example. Suppose your height is 160 centimeter. Measure your height today and list that. Okay, in tape, measuring tape. Your height is 160 centimeter. Just minus 100. 160 minus 100 is equal to 60 is your height as per Broca's formula. Okay. So if you want also, you can check that and let me know. Next class I'll ask who have perfect normal height. Mostly I think 60-70% students have abnormal height, abnormal weight. Okay, abnormal weight. And avoiding tobacco use can prevent or delay the onset of this type 2 diabetes also. We have so many studies now. Yeah. So risk factors of type 1 diabetes we know mostly due to early foods like early exposure to cow milk, bovine milk that is called. If you go to Nelson pediatric book, it is clearly written the early introduction of cow's milk to the in place of breast milk is one of the most important factor for type 1 diabetes. Okay, so remember that always mother milk, food, human mother milk is for human, cows for cows. Okay, remember that. So if due to some issues during birth or something during breastfeeding, then if we introduce a child or bottle feeding with cow's milk, then high chances of there is type 1 diabetes. Okay. So always remember this: if you should have to give always mother's milk, not any cow's milk to the child. Obesity is one of the also risk factor of type 1 diabetes. If you are taking some drugs also, like some have seen some TB. One of my patients was taken anti-tuberculosis drugs and developed type diabetes after some days because some immunogenic reactions occur to pancreas, and that leads to type 1 diabetes. Born by an older mother more than 40 plus years of age, that's also one of the risk factors. uh, mm, Down syndrome, as you learn from your pediatrics also. Having a mother with preeclampsia also chances more development of type 1 diabetes due to blood pressure. Okay. So these are all the risk factor for type 1 diabetes. Cow's milk is one most important one. So never try to give any other milks except mother milk to the child. Always try to give the mother's milk. Okay. And I will tell how to diagnose type 1 diabetes. Always remember there is a test called C peptide level, C peptide, which the value is more than 1 to 2.5. But if the value is less than zero point 0.4, that means patient is suffering from this type 1 diabetes, C peptide level. And C peptide level also helps to know what are the level of uh, the lines. Am I audible? Around 125 students are there.
Yes, sir.
Good question, Sarthak. I'll answer your every questions. No need to worry. Am I audible? And anyone, please let me know whether audible or not audible. Because now, due to some network issues, am I audible? Hello. Current has
Yes, sir.
gone here, so that's I am asking. Am I audible? Just type in the chat box, Sarthak. Audible, Anisha. Good, thank you. Okay, so let's go to. Oh, yeah, 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 yeah. This is a risk factor for type 2 diabetes also. Which is okay. So, risk factor for type 2 diabetes, as I over told you, over three-fourth related of the disease related to this high body weight. That means more than 75% people with obesity are the major risk factor of this type 2 diabetes. High blood pressure also leads to diabetes. They are all associated, And abnormal your triglyceride level, age 45 plus, also one of the risk factor. Family history of diabetes, genetic like Indians are more, the Chinese also more, like that. Okay, so major risk factors which are modifiable, we should focus more on that things that we can change. This is in our hand. What we cannot control, we should not more focus on that things. Okay, so we should always focus on the modifiable risk factors which can be modified, which is our own controls. Okay, so I hope next class. Just a minute, just a minute, just a minute. We should discuss some issues, then we'll go to thank you. Not because time always, we have only have 15 minutes there. Osteoporosis and dental disease come to. This is also one of the modifiable risk factors. Okay. One of the NCDs, sorry. Yeah. Osteoporosis is the disease of the bones. Just a minute. Okay. So this is the osteoporosis, a disease of the bone that leads to increased risk of fractures. Overconsumption of dietary proteins, less physical activity, vegetables means less calcium. Okay, that leads to this disease also. Less vegetables, less calcium, normal calcium. Okay, that leads to also dental issues because of this osteoporosis. Bottle feedings are highly suspicious. High sugar containing foods, ice creams, ignorance, urbanization. So during my study, if anybody has any questions, just put that down in the chat box. Also, I am happy to answer that questions at the end. Okay. Yeah. Cancer. Yeah. Generic term for a large group of disease that can affect any part of the body also, because it's the final stage of the disease. After NCDs, some cancer is the major disease. If we can control, can modify that. Rapid creations of abnormal cells that grow beyond their usual boundaries. Okay, that's called tumor. Okay, and which can then invade adjoining parts, and that's called metastasis of the organ. This is the definition, WHO definition 2012 of cancer. There's a two type, there is tumor or benign or malignant. If it is inside a particular organ within a boundary, this is called benign. And it crosses the boundary and go to a distant places adjoining parts of the body, that's called malignant tumors. Okay. Rapid creation of abnormal cells. These are not normal, okay, mutant cells, okay, that grow beyond their usual boundary, which can then invade adjoining parts of the body and spread to other organs. Okay, this is the definition of cancer. What is cancer? This is the definition. Okay, and this is mostly two types: benign and malignant. Okay, cancer, some types of cancer, as you know, 30 percent of all cancers in Western countries, approximately 20% of the developing countries, where most of the cancer related to these chronic infections also, like HPV infection lead to cervical carcinoma also. Okay, and some bad nutrition, more fat, that leads to breast cancer also. Okay, so good nutrition also always assist in fighting the cancers, because we always advise our patients to take anti-inflammatory diets. Not inflammation means chronic inflammation means your body is inflamed. Flame means fire. Okay, so if you are taking the diets which are inflaming your body, that means causing inflammation, that lead to chronic inflammation. If you change the diet pattern from inflammatory diet to your anti-inflammatory diet, then you easily reverse the disease and heal fast with the recovery. Okay. Yeah. So what are the risk factors of cancers? Nutritional and lifestyle factors are most important, because if we change the nutrition, everything will change. Okay. So, but we have to counsel the patient first. Without counseling, they never want to change their diet pattern. Without understanding the complications of the disease, they never change their diet patterns. Okay, so high fat risk of colon, uterus, prostate, that leads to all cancer: colon cancer, uterine myoma, fibroid uterus, prostate cancer, BHP, benign prostate hypertrophy, increased PSA level. Okay, overweight and lack of physical activity uh, are the main cause of breast cancer, esophagus cancer of wrong eating, kidney disease, kidney cancer, renal cell carcinoma, uterus cancer. Okay, alcohol is one of the most important risk factor for your lung cancer and your oral GI tract cancer, esophageal, larynx, liver, and breast cancer also. Tobacco use, as you know, most common your mouth and your tongue cancer. Okay, larynx, mouth, esophagus, bladder cancer also. Nicotine, more amount of nicotine, that leads to this cancer. Okay, these are the all modifiable risk factor. We can modify that. So preventions of this nutrition related NCD mainly depend on your education, starting from at school, setting examples of healthy living. Okay, so we have to give health promotion. Promotions means we have to go to schools. We have to start the education a particular topic on this health and nutrition. Okay, And then so from that school level, if the diet pattern is changed, then the sufferings will be less. Dietary guidelines educate the public about the healthy eating, whatever we are doing now. In a camp also we are trying to have the people in a community level also, in some community functions also we try to change their lifestyle by giving this education, promoting healthy behavior in general and reducing the fast food facility and use of saturated fats to decrease that. Okay. Screening of populations regularly by doing health camp, hypertension, overweight checking, BMI by checking, diabetes checking by blood sugar. Okay, you as a medical students, na, you must have one blood pressure machine, either digital or sphygmomanometer now available everywhere, and also one of the this blood sugar measuring machine now as a medical student, because you should, when you go to your place, your home, your surroundings, your relatives, your village, you should also measure this kind of parameters. Screening camp, you just go through your home, they know that you are going to future budding doctors. And so from now, where you are not starting that, you just screen the community. Okay, screen that. And we also let you know, after the screening you get some points, you get some diabetes, you get some overweight. Okay, like that patients. So screening can help us to detect the patients early to take initial actions. Mass promotions of physical activity by doing yoga day, international yoga day, like that. And walking, running, jogging, everything. Then then do some and other food policies, so that the mixing of the foods, adulteration of the foods, and the refining process, that means to prevent the food adulteration, some policies should be there. Then intersectoral coordination, collaboration, like in Finland, national price and the food labeling policies were combined with nutrition education programs, like that. Because we need to, like, our department, health sorry for this interruption, because due to this network issues or some current issues. I cannot connect you due to this. I lost my slides also. No, I lost some questions in the message box, chat box. I have some doubts here, but I cannot see the doubts again. So if anybody is in a doubt, you can please retype that in the chat box so that we'll discuss in the next class, more details on prevention methods. And I will also describe some diet plan, medical diet plans, meal diet plans, what is not allowed. My plant-based diet also I'll give you at that classes. So in the next class, we'll detail discuss on our diet and all these issues. Because of some technical issues, I cannot conduct this thing. So if anybody is in a doubt, they can please type their questions in the chat box. I think yes. Is the screen not visible? Screen already I finished mostly, but yeah, yeah, my screen. Okay, good. I hope my screen is visible to you now because we have only 6 minutes left, so I just complete this thing. I think yeah, risk factors for cancers as I told, high fat diet and all this thing I have told to you. But yeah, so this is thing magical diet plan. I have a magical diet plan also for you, the meal blueprint plan, and what is not allowed in my diet plan. I never allowed my patients of NCDs to take any non-veg foods, any refined food, any milk and dairy products. Reduce the amount of tea and coffee, food from the refined flour and from sugars. Okay, and I advise this type of diet as you see some herbal tea in the morning, then also some good detox juice like askar juice or your coconut water or fresh seasonal vegetable juice, green juice. Also adds to the composite chapati. I can share the recipes of these diet plans, dear students. No need to worry about at all because we also in the next class we read details about this thing. And yeah, you can see this is one of my diet plans, but it is not clearly visible, I think. And I'll give you more details on this diet plan in the next class, where we will discuss some other issues also. And thank you all because already 5 minutes left. And next class we'll discuss the role of whole food plant-based diet. WFPD means whole food plant-based diet, in depth and prevention and reversal of NCD. That means reverse how to reverse that. Suppose one person's taking so much of insulin like and other medicines. How to reverse that we'll discuss in the uh, next class. Okay. So I'll come to some questions now. I think yeah. Dr. asking, good afternoon, sir, regarding that consumption of milk and milk products and meat, you told these foods should be avoided due to direct cholesterol from the animals. But, sir, these are also very important source of protein and milk with regard to the complete food. Yes, milk is complete food, but nowadays, due to some mixing property, so many antibiotics, so many pesticides, so many hormones, all this are mixed to the milk now. So, because this is a hypercaloric diet, we can give to the patients like tuberculosis AIDS patients. Those are thin-built persons, but not to the persons those who are already insulin resistance. Obese persons. Okay, because obese persons means that persons are already insulin resistant. That means I will explain you also what is HOMA IR in the next class. That means what is the level of insulin resistance, what is first normal level of fasting insulin, and milk and milk products contain IGF, insulin like growth factors. Okay, that is one of the most important risk factor for obesity, and obesity is the most risk factor for this all this NCD. That's why I am refusing, dear Sarthak. Hope you got my points, and also so many other points. I have a one of ODI video for my patients. I'll share you personally if you need that. Where to avoid the milk? Yeah, good question. So, aren't the benefits of overweighting? Oh, no, or this should be avoided for the persons who are NR NCDs first. Okay, and because these foods are important nutritive source, plant-based diet, vegan may be best for me, because I have seen good results with these patients, those who are suffering from diabetes, hypertension. They are mostly over caloric diet they are taking, so we have to reduce the calorie also in that person. So according to persons to persons, we have to give the diet. That should be individualized, not same for all persons. Okay. Yeah. Which is the best diet? Personal diet plan is best diet. Individual diet plan. And I always advise for whole food this diet. Okay. Because I know the power of this diet, because this is the anti-inflammatory diet also. Okay. Next question is Shumani Chauhan. Yeah. Sir, as banana contains a lot of natural histamine, so according to you, today's session, banana must come under inflammatory. No, never. Which should be avoided in serious problems. Natural histamines. Contains natural histamines. You just go to the nutritive value of banana. Okay, Shomanya Chauhan, just go to nutritionfacts.org. Just see the nutritive value of this banana, because banana contain mostly potassium, and that is good for, as I told, good for CBD. Also, we are avoiding in first initial phase of type 2 diabetes to increase level of sugar. But we can give banana safely to the persons who are in phase 2 or phase 3 diabetes. We can give that. Banana most common inflammatory. No, not inflammatory food. But at the same, banana is actually a great source of K plus. Yes, and high K plus decreases the level of serious complaints. So, should we advise banana to? Yes, obviously, we advise banana, but you should always advise the banana. Best banana is your local market or your local made, or that should not be imported from outside with carbide, so much of carbides, that causes problem also. So always try to choose banana is not so much matlab, bad foods or so much inflammatory. It's anti-inflammatory. It's not comes under inflammatory food, dear Shuman Nichova. It's an anti-inflammatory food, remember that. But in case of blood pressure patient, in case of cancer, we can give that. But in case of diabetes type 2 with high level of sugar, we initially avoid for some days, but after that also we give that also in phase 2. Okay. So banana is not so bad as you think about the banana. Okay. Because with uh, banana also contains so much protective potassium. Yes, good, right. And also we discuss in the next class details diet plans, what is insulin resistance, and what is other resistance. As you see, because I have so many patients in my community, I have seen, as you told, these are the patients. Hope this screen is visible to you. And this patient HbA1c 9.6, glycosylated hemoglobin to 5.1 now. No one can believe that this also, but this is the truth. If we change the diet plan, everything will change. He is non-diabetic now, who was taking initially 52 unit insulin daily. His number is this also. You can note down this number and call to this person also. Okay. And so many persons, I have so many patients also, and some cases I have given you to create the interest on you on this topic of nutrition, because nutrition is the most important topic. Remember that things. Okay. And next class, we'll discuss on your some reversals techniques and diet. Okay. Hope. So okay. Thank you so much. I think is your next class after 3 p.m. Whether is there any class or no classes? Sarthak, is there any class after 3 p.m.?
Yes, sir. Class is there.
Is it online or offline?
Sir, online.
Okay, okay. So I have to left the class because already it's 3 p.m. Then next class we'll discuss other issues. Okay. Thank you. Thank you.
Thank you, sir.